Hi everyone, my name's Amanda Harris. I'm the owner of Re-Kinect, and I am here today with Dr. Peter Bauer in Charlottesville, Virginia. Dr. Bauer is one of our very treasured referral partners here in Charlottesville, and I thought I'd ask him to tell us a little today about the difference between manual medicine, as he practices it here in Charlottesville, and what we might think of as traditional medicine.
Okay, my pleasure. And I want to say also thank you for coming over and having this little talk with us today.
Oh, happy to do it.
So what's the difference between manual medicine and regular conventional medicine? Well, I would see it as it's everything that regular medicine is in terms of the analysis of disease process and making treatment decisions to improve function, decrease pain, but it's a method taught by the osteopaths for over 100 years of being able to put your hands on a person, physically diagnose mechanical strain patterns and painful conditions, and using your hands itself, you can change those patterns to try to affect improved function and decreased pain.
Wow, that's a mouthful.
Yes.
And I would say quite unique in that these days a lot of our clients come to us and say, the doctor who was diagnosing my fill-in-the-blank problem never even put his hands on me.
I think there's a lot of reasons for that. One is the extraordinary advance that we have in all kinds of imaging, diagnostics, and blood tests and ultrasounds. Many doctors have come to rely on those strictly as the objective findings associated with disease process. Still, medicine requires doctors to use common sense, take a history, do a full physical examination, as well as take into account any of these other tests that to produce a diagnosis that is meaningful. That part of physical exam in particular seems to have taken second seat to the diagnostic testing. People can trust what an MRI shows them, whether or not it's showing them accurately what's really wrong.
Right.
That's what you use your hands to confirm. That's what you use your eyes and your ears when you're examining patients. So the traditional way of doing an examination is you take a complete history of a person, you do a physical examination. From those two things, you should be able to determine really what's wrong with about 80% of people. Of the remaining 20%, testing is needed to determine which of these other conditions might be causing it. So many times you have people who have had evaluations for low back pain, they've had x-rays, they've had MRIs, the MRIs find a problem, and that's taken over as the diagnosis, this finding, when they know full well that at the age of 40, men with no problems whatsoever with their low back, 40% of them have abnormal MRIs. So if you also have back pain and an abnormal MRI, you've got a 4 out of 10 chance of that finding not being your problem. But everybody more or less in conventional medicine these days will look at that, and that'll be what they use to determine what's wrong with you. I've seen many people go down the wrong rabbit hole following findings on these diagnostic tests, when in fact, all they needed was somebody to palpate and find out that it really isn't their low back, it's their hip, or it's their buttock, or something like that.
Right. And so we get to that saying of often that where the pain is not necessarily where the problem is, right?
Correct.
Now, you were one of my early teachers in fascia and the role of fascia in both healing from musculoskeletal injuries as well as in exercise. Can you tell our audience a little bit about fascia and how you manipulate it as a practitioner? And maybe if you have time afterwards and breath left, you can talk about what you feel like the role of exercise is in helping to rehabilitate that fascia.
Sure. Fascia is truly amazing. It's the largest organ in the body. More recently, even in the New York Times recently, they've had an article about fascia as if it's just recently been discovered. No, fascia is the framework within which our body fills in. When the embryo is forming, the very first thing that happens is the fascia kind of makes the lines in a coloring book. All of the different cells, the gut, the brain, fill in the holes left by the fascia. It gives the definition of the body itself. The other thing about fascia is that's where all of the nerves exist that give us the feeling of being present within our body. All the pain fibers, the position sensors, the vibration and temperature sensors, they're all in our fascia. So what we feel as being alive in us is we're feeling our fascia. The other thing about fascia is it's one piece throughout the entire body. It's completely united into one unit itself. Everything else is broken into pieces, but not the fascia. So people with mechanical dysfunction, say, people with back pain, most often, if it's not something where you've torn or ripped something apart, you've distorted this fascial wrapping to a point where it no longer moves correctly. As you put strain patterns into it, as you move into it, the areas that are bound together that don't slide and move independently begin to feel pain. Swelling will happen, and then you're off to the races. The manipulations are to affect an improvement in the mechanical functioning of this fascia that we're made out of, okay? Now, fascia is technically this fine material. It's the stuff, it's the white of the meat that you might see when you're cooking with a steak of some sort. But it also is continuous with the ligaments and tendons of the body. And in fact, the bones of the body too generate from the same structures. So what's the hard part of us, what's the physical part of us, what holds us together, integrates us, controls our movement, and controls what we feel to be human even, is that fascia.
Awesome.
How's that? All right?
That's great. So, you know, I think I've read somewhere that instead of thinking about the muscles hanging on the skeleton, you know, to move the skeleton around, we need to think more about the skeleton being suspended in a web of fascia.
Correct.
Right, that has muscles and tendons and ligaments all within it, but it literally suspends our bodies in this web of fascia. So when we look at the body in this way, which is a unique perspective for many of us, let's talk just briefly about the effect of exercise on that fascia, or how we load the fascia when we're coming back from maybe an injury or some sort of a painful situation.
With movement, with healthy movement, you can think of the fascia just like you said. It's this huge suspension network. It's shock absorbers coming from every which direction that you might move. If there's an area where that suspension system has been distorted or torn or broken, that's a place where weight and load will go into inappropriately. Some other place will then have to take over and do the job that was meant to be done there. Exercise is important for a number of reasons. Number one, the way we're designed is absolutely glorious mechanically. Exercise and movement are really what heal us. They allow the body to unwind itself from these distortions and bring strength and stability back into the functioning of the structure. In addition, exercise is what is an enormous pump of fluids throughout the body. Most of these tissues get their nutrition from movement, not from, say, your heart muscle and blood vessels. In order to feel good, you need to move everything in your body every which way as often as you can, and that promotes this deep circulation of fluid through these deep tissues. Nothing does that better than exercise. Diversity of exercise is also important. Not to say that doing an elliptical as your exercise is bad for you. It's great for you, but it's only if the world was an elliptical would that be good. We do many other things. Our body is shaped to do many other kinds of activities, and if you don't use them, the body kind of gets tightened up and rusts a little bit. So good health requires a robust amount of exercise and movement of all diverse kinds. In particular, the kinds of work that you do, which I like so much, is because of its incredible depth and accuracy in diagnosing places where that system has broken down and identifying that and tailor-making a unique system of exercise that will incorporate that movement pattern into these dysfunctional things. Our body heals by movement and exercise. That's what really will set us free.
Yeah, and I know you have often said to me when I've said, what's the best exercise to move forward with XYZ situation, and you have said a variety of movements often. So you mentioned that in that answer, so I appreciate that, and I hope that is something that our viewers can really take to heart. So Dr. Bauer, thank you so much for spending time with us this afternoon. It's been a pleasure learning from you. And if somebody would like to reach out to you to be seen by you, what's the best number they should call or website they should visit? Or
you can go to www.peterbauer.com, peterbower.com, or 434-964-0159 is our office phone number, and Teresa will take your call.
Great. Thank you so much, Dr. Bauer.
Thanks for coming by.
Okay.